Dr. Shapiro, let's start with you. How did you go into this type of work? I know that you are a cancer survivor yourself.
Right. I was diagnosed when I was 20 with a lymphoma and then spent the next 5 years in and out of treatment. And it was while I was also just trying to decide what to do with my life, and eventually decided to become a psychologist and actually study patient responses to illness. I also felt like the system wasn't that great, so I got really interested in medical systems and patient-physician communication, that sort of thing.
And I'm very curious to know more about your work with couples coping with cancer. Obviously, you've had the personal experience of being in both roles, and I also know that you've worked with many couples. What are you finding as the most common conflict points between those couples?
I'd say there are a couple. I think one of the early conflicts is around how to deal with authority and physicians, for example. Some folks are really deferential to physicians, while others are really aggressive, and that can lead to conflicts between couples. I think couples also fight about how they think about illness. For example, they have fights about, well, you're not being optimistic enough, you're not thinking about this the right way. That's another area. And then finally, I'd say the other big one is food. Couples fight about food and eating.
Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.